Good morning, my dear beloved student. I am Dr. Ghosh, Assistant Professor Physiology at Sakina Women's Medical College, Jashore. Today, I will discuss about the important system in physiology, that is respiratory system. Okay, it is very important system regarding your examination. So, first of all, for knowing this respiratory system, you have to learn about the what is respiration. No, so then what is respiration? Nothing but inhale air and expel air between lung alveoli and the atmosphere. No, so what is definition of the respiration is nothing but intake of air, and that will provide it to the tissue, and production of the carbon dioxide, and that is removed from the body is the definition of the respiration. Okay. So, for this purpose we that can be achieved, for the respiration can be achieved or purpose, it is divided into two processes, that is external respiration and internal respiration. Okay. So, what do you mean by external respiration? External respiration is nothing but intake of air and the removal of the carbon dioxide between the atmosphere and the lung alveoli. And what is internal respiration? Internal respiration is nothing but it is utilization of oxygen by the tissue and removal of oxygen by from the tissue to the blood or even out of the body. Okay. So, this is the two process that serve the purpose for the respiration. So, going to these processes, and that there are so many goals or function of the respiration, and that can be done, and for this intake and utilization of oxygen by the tissue, and that is production of the carbon dioxide, and that is transport and remove from the body, that can be achieved by so many goals, and that can be discussed in one by one steps. So, what are the goal of the respiration, or what are the function of the respiration? First of all, that is pulmonary ventilation. What do you mean by pulmonary ventilation? That is inflow and outflow of air between the lung alveoli and the atmosphere. So, what is the basic difference between the respiration and the ventilation? Ventilation means external respiration. Now, it is a part of the respiration that will inflow air from the atmosphere to the lung alveoli and outflow of air from the lung alveoli to the atmosphere. Next step, the air has been passes to the alveoli. Now, you have to move the air from alveoli to the blood. For this reason, they have to diffuse. No? So, next point, the next function is the diffusion of oxygen and carbon dioxide between the lung alveoli and the blood. Now, the air or oxygen or carbon dioxide has entered into the blood, that now you have to transport this oxygen or gas or air in the blood. So, next function is the transport of oxygen and carbon dioxide in the blood. Okay. And the last one is the regulation of the respiration. These all process is done by the regulation of the respiration. Okay. So, these are the four major function for the respiration, and they will be discussed one by one. First of all, now you have to learn about if this respiration occur, then what are the part that involve in this respiration. Respiratory system is made up of gaseous exchange organ and the pump that will ventilate the lung, and the pump is consisting of the chest wall and the respiratory muscle, which this pump will increase or decrease the wall of the thoracic cavity and thoracic cage, and thereby the lung will inflate or deflate. Okay. And this inflation and deflation of the lung, or expansion and decreasing of the size of the thoracic cavity, is regulated by regulatory system in the brain, and that is connected with the nerve fiber and the tract. Okay. So, what are the part in that will comprises the respiratory system? That is a gaseous exchange organ and the respiratory tract, and a pump that called the thoracic cage with the corresponding muscle. Now, the respiratory tract has been divided anatomically into upper respiratory tract and lower respiratory tract. There is a reason for division of this respiratory tract into two parts, as because during in practicing life, the physician write about that if there is a symptom in regarding this respiratory tract disease, and that is called upper respiratory tract infection or lower respiratory tract infection. According to this, you have to know what is called which part is consisting of upper respiratory tract and which part is consisting of lower respiratory tract. So, upper respiratory tract start from nose to vocal cord in the larynx. Okay. Upper respiratory tract is consist or start from nose and it will end in the vocal cord of the larynx, and lower respiratory tract from vocal cord up to the lung alveoli. Why we will read this division? As because the symptom is differ in upper respiratory tract and symptom is differ in lower respiratory tract. So, for this reason we have to know this about the anatomical division of the respiratory tract. Now, the physiological division of the respiratory tract, it is divided into conducting zone and the respiratory zone. Okay. The conducting zone is nothing but they will conduct air and there will be no gaseous exchange in this portion of the respiratory tract, and they act as the only reservoir of the gas. Okay. So, this is called conducting zone. As it is called conducting, why it is called conducting zone? As they will conduct the air from the atmosphere up to the respiratory zone. Okay. And they act as the reservoir of the lung. And which portion it is comprises? It is comprises from nose to the terminal bronchiole. Okay. It may be defined in the anatomy, that is bronchial tree. It is a part of the bronchial tree that will conduct air. And now the next division is the respiratory zone. We have told that the physiological division of the respiratory system is the conducting zone and the respiratory zone. I have told you that conducting zone comprises from the nose to the terminal bronchiole. In respiratory zone there will be gaseous exchange. They will comprises the gaseous exchange, and they will start from respiratory bronchiole to the alveoli. There are usually 6 to 7 division in this respiratory zone. They may be defined as respiratory unit. Sometime question may comes as what do you mean by respiratory unit, but what is respiratory unit? At the time you have to know the definition and the part of this respiratory zone. Okay. So, what is definition of the respiratory zone by respiratory unit? It is the definition that it is the area of the respiratory tract where gaseous exchange is possible. And what are the parts? That is respiratory bronchiole, alveolar duct, alveolar sac, atria and an alveoli. These are the usually there are 2 or more division that can be included here. About 5 to 7 division is present in the respiratory zone. Normally, there are so many alveoli are there in a lung, and near about 300 million alveoli are present in true lung, and the lining epithelium of the lung alveoli is very thin, which is lined by usually simple squamous epithelium, and the diameter of this lining epithelium is only 0.2 millimeter, for where the gaseous exchange may be possible. Okay. And this alveoli is surrounded by a tuft of capillary are connecting with each other, so that gaseous exchange or diffusion of gas is easily possible between this lung alveoli and the blood. Okay. Now, the alveoli is normally lined by major 2 type of epithelial cell, that is one is type 1 alveolar epithelium, and it is about 95% of the total mass of the lining of the lung. Okay. And which is simple squamous epithelium, and which is responsible for gaseous exchange. And the type 2 alveolar epithelium, but type 2 pneumocyte, about 5% of the total mass is contributed by this type 2 alveolar epithelium, which is responsible for secretion of surfactant, and the surfactant has a role in prevention of the lung collapse, and they will prevent lung collapse. And there are so many supporting cell are there, like alveolar macrophage, mast cell, chip cell and lymphocyte, plasma cell. They are act as a supporting cell and support the lung tissue. Okay. So, these are the histological structure in the lung, within the lung. Okay. Now, we will discuss about the dead space and the dead space here. A dead space is nothing but conducting zone. It is normally, if you say that what is dead space, it is nothing but conducting zone. What is dead space? The space which is occupied by the air, but that does not take place in the gaseous exchange is known as dead space. Okay. And the air present within the dead space is called dead space air. So, what is the dead space? that is nothing but I have told already the conducting zone. The dead space can be divided into two, that is anatomical dead space and physiological dead space. Anatomical dead space and physiological dead space is same. There is little difference between the anatomical and physiological dead space is the normally anatomical dead space is nothing but conducting zone. Air that is occupied by this conducting zone is 150 ml. How much? It is 150 ml of air is occupied in the conducting zone of the tissue. Physiological dead space. Okay. Physiological dead space is same as anatomical dead space. Submission of the space that is non-functioning alveoli. Okay. Normally in lung there is non-functioning alveoli is not present. If there is a disease condition, then non-functioning alveoli will be added to this anatomical dead space. So the anatomical dead space and physiological dead space is same. It will increase when there is a disease in the lung. Okay. So these are the two type of dead space, that is anatomical dead space and physiological dead space. Anatomical dead space means conducting zone that occupied about 150 ml of air, and physiological dead space same as anatomical dead space plus non-functioning alveoli. Okay. What is the importance of knowing this dead space? They are not take part in the gaseous exchange, but God has made so many function about this conducting here dead space here. So what is the function of this dead space here? First of all, they act as first line defense of the lung, but first line defense of the respiratory tract. Whenever any organism or dust particle will enter into our body through the nose, they will immediately remove the organism, they will kill the organism, they will remove the dust particles. So they act as the first line defense of the body, and second, they will remove the dust particles as more than 2 micron by either sneezing or coughing. Okay. So these are, and they will condition the air whenever we inhale some air that is hot or cold or bad smell, that is conditioned within this conducting zone or dead space, and thereby they will process to the respiratory zone. So these are the important function of the dead space air and the dead space of the respiratory tract. Today up to this, thank you very much.